This presentation is about the general guidelines for treating horses with acute laminitis. It is in no way meant to be a substitute for a qualified veterinarian's assistance and a good farrier to treat your horse. It's based on the best science-based evidence that we have about the disease, and also based on my personal experience treating the disease for the last 4 decades. The symptoms of acute laminitis are that the horse has pain in his feet, which is demonstrated by him shifting his weight, moving his weight back onto his heels, reluctant to move forward. If you feel the feet, they'll feel warm. There's an increased digital pulse which can be felt or palpated in the back of the pastern of the horse. The horse is reluctant to move. He oftentimes doesn't want to give you his foot if you ask him to pick his foot up because he's reluctant to bear his weight on the opposite leg. They'll oftentimes walk fairly normally in a straight line, and when you start to turn them, you'll see that they rock back on their hind end and they have an abnormal gait when they're trying to turn. When horses have acute laminitis, it's important that you seek veterinary care immediately. While you're waiting, icing the horse's feet can be of a great help to them. Icing feet has been the only treatment that has proven effective in preventing laminitis in horses. So using ice water, boots, whatever way you want to do this, up to the mid-cannon bone of all 4 legs can help arrest the process from continuing. It's very important that you identify the cause of the laminitis and try and remove that if at all possible. One of the biggest mistakes I see is people get carried away trying to treat the feet and they don't think about what's the reason the horse has gotten this condition anyway. But if you don't identify that and remove it, the process will just continue onward. Treating acute laminitis is complicated. I usually recommend that the owner get a set of radiographs on the initial day that the horse shows symptoms. This way we'll have something to compare to as the disease progresses to see what changes have actually occurred in the feet subsequent to the initial onset of the disease. It's important also to use drugs to reduce the inflammatory reaction that's going on in the horse's foot. There has been no evidence, though, to show that these drugs are of any real benefit in treating laminitis. They merely make the horse feel better. This makes us feel better, but oftentimes this can be dangerous because if the horse is allowed to move around too much because he feels better, he may actually do more damage to the lamina. I'm usually in favor of trying to confine the horse till we know more about what's going on in his feet and allow him to seek recumbency so that he takes the weight off of the lamina. Also, I think it's important that we go ahead and remove the shoes from the horse and put some sort of a support device underneath the horse to cushion his feet and give him some support until we've further evaluated the severity of this case of laminitis. After the horse has had emergency treatment and has been stabilized, it's important to turn your focus onto trying to determine which of the pathways is involved in causing the laminitis. If it's the enzyme-activated pathway, oftentimes the cause of this is quite obvious. The horse has broken into the grain, a mare has a retained placenta. Treatment of these conditions will alleviate the cause of the laminitis, and then you're just left to deal with the damage that's been done in the foot. If, on the other hand, you're unable to determine the cause of the laminitis, or if the cause seems to be associated with the intake of grass, you need to do some blood work to determine what the hormone levels are within this animal's system. The blood sample is best taken when the horse has been fasting for 3 to 4 hours, and we want to find out what the level of insulin is within this horse's bloodstream. If the insulin level is elevated, then this is what is causing the horse to develop laminitis. The treatment for this form of laminitis will oftentimes involve putting the horse on a diet and an exercise program and using some drugs to help reduce the level of insulin within the system. The third type of laminitis that we discussed earlier, the contralateral limb or supporting limb laminitis, These horses that develop this when they have a severe injury to the opposite limb are best treated by placing the horse in a sling to unweight the affected limb. Although we've been able to identify these 3 separate pathways that cause laminitis, we still know very little about the actual mechanism that's involved in initiating the disease process. That's why we need more research to be able to tell exactly what's going on inside of the horse. Once we understand this, we will likely be able to find very early biomarkers that are present within the animal system that tell us this is going on. Right now, we are reactive and not proactive in this disease. We react to the presence of pain and destruction of the horse's foot. The bottom line is that we need more research to completely understand this disease. I hope you found this information helpful, and you can see that we have made a lot of progress in understanding the disease. I'm hoping that you will join us by giving us a financial contribution to the Animal Health Foundation so that we can fund more research, so that we change our position from merely reacting to this disease to being proactive and being able to prevent it, so horses don't have to suffer the enormous pain that they do when they have this disease. You can make a tax-deductible donation through PayPal on our website, or send a check to this address. We hope you'll join us in freeing the horse from this disease. Thank you. Take the time to view these videos. It may actually save your horse's life.